Every single day, your liver performs over 500 essential functions. 500. It filters your blood, breaks down medications, produces bile for digestion, and neutralizes the toxins you eat, drink, and breathe. It is the most overworked organ in your body. And right now, millions of Americans are unknowingly destroying it. I had a patient, 47 years old, active guy, thought he was reasonably healthy. He came in complaining of fatigue and some itching on his skin. Nothing dramatic. No pain. No obvious symptoms. But when we ran his labs, his liver enzymes were through the roof. His liver was in serious trouble, and he had absolutely no idea. That is what makes liver disease so dangerous. It is called the silent killer for a reason. Your liver does not have pain receptors the way your muscles or your stomach do. By the time you feel something is wrong, the damage may already be significant. So today, I am going to walk you through 5 warning signs that your liver is overloaded with toxins. These are signs your body is already sending you. And I am going to show you exactly what to do about it before it becomes a crisis. The first warning sign is chronic fatigue that sleep does not fix. This is the #1 complaint I hear from patients with early liver dysfunction. They are tired. Not just a little tired, deeply, bone-crushingly exhausted. They sleep 8 hours and wake up feeling like they never rested at all. Here is why. Your liver is responsible for regulating blood sugar and converting nutrients into usable energy. When it is overloaded with toxins, from processed food, alcohol, medications, or environmental chemicals, it cannot do that job efficiently. Your cells are literally being starved of energy at the metabolic level. Think of it like a power plant running on dirty fuel. The turbines are still spinning, but everything is slower, dirtier, and less efficient. That is your liver on a toxic overload. If you are exhausted all the time and your doctor cannot find a reason, demand a liver function panel. Do not accept you are just stressed as an answer. The second warning sign is persistent bloating, gas, and digestive issues. Your liver produces bile. Bile is the digestive fluid that breaks down fats in your small intestine. When your liver is inflamed or congested with toxins, bile production drops and bile flow slows down. The result? Fats are not properly digested. Food sits in your gut longer than it should. You feel bloated, gassy, and uncomfortable, especially after meals. The standard American diet, high in saturated fats, refined carbohydrates, and ultra-processed foods, is one of the leading causes of what we call non-alcoholic fatty liver disease, or NAFLD. And NAFLD now affects approximately 1 in 4 American adults. That is 80 to 100 million people walking around with a liver that is literally storing fat it cannot process. If you feel consistently bloated, if your digestion is sluggish, if fatty meals make you feel sick, your liver is sending you a message. Do not ignore it. The third warning sign is yellowing of the skin or eyes. This one is called jaundice, and it is a signal you cannot ignore. When your liver is overwhelmed, it cannot break down bilirubin fast enough. Bilirubin is a yellow pigment produced when red blood cells are broken down. Normally, your liver clears it quickly and efficiently. But when the liver is congested, bilirubin builds up in the blood and deposits in your tissues, turning your skin and the whites of your eyes yellow. If you see a yellow tint in your eyes or skin, you need to see a physician immediately. This is not a wait-and-see situation. This is a go-today situation. The fourth warning sign is dark urine and pale stools. Your urine and your stool are literally diagnostic windows into your liver health. Dark, tea-colored urine, especially in the morning when you are hydrated, can indicate elevated bilirubin being excreted through your kidneys. That means your liver is not clearing it properly. Pale, clay-colored stools tell you something even more specific. Bile gives your stool its normal brown color. When bile flow from the liver is blocked or reduced, your stool loses that pigment. It turns gray or pale. That is a direct sign of bile duct obstruction or severe liver dysfunction. If you are seeing either of these changes consistently, get to a doctor and ask for liver function tests and an abdominal ultrasound. The fifth warning sign is unexplained skin problems, itching, rashes, and spider veins. Your skin is your body's largest detox organ after the liver. When your liver is overwhelmed and cannot filter toxins from the blood, those toxins have to go somewhere. They come out through your skin. This shows up as chronic itching, sometimes with no visible rash at all. It shows up as unusual skin rashes, acne in adults, or a dull, yellowish skin tone. It also shows up as spider angiomas, those small, spider-like red blood vessel clusters on the skin. These occur because a damaged liver cannot metabolize estrogen properly, causing blood vessels near the surface to dilate. If your skin is itching for no reason, if you are breaking out in ways that skincare products cannot fix, the problem may not be on your skin. The problem may be inside your liver. Now here's what you do about it. Stop putting toxins in faster than your liver can take them out. That means reducing alcohol, yes, even the one glass of wine a night habit. It means cutting back on ultra-processed food, artificial sweeteners, and fast food. The standard American diet is a direct assault on your liver. Hydrate properly. Your liver needs water to flush toxins into bile and urine. Aim for at least half your body weight in ounces of water per day. Add liver-supportive foods to every meal: broccoli, cauliflower, Brussels sprouts, beets, and garlic. These activate liver detox enzymes at the cellular level. Move your body for 30 minutes every single day. Exercise reduces liver fat directly. Studies show that moderate aerobic activity can measurably reduce liver inflammation and fat accumulation in as little as 12 weeks. And get tested. Ask your doctor for a comprehensive metabolic panel, liver enzyme levels, AST and ALT, and an abdominal ultrasound. Many liver conditions are completely reversible when caught early. But you cannot treat what you do not diagnose. Now here's the one thing most people do not know, and you will not find this on Google. Most people have heard of milk thistle for liver health. But the active compound, cellular, works best when combined with phosphatidylcholine, a compound found in sunflower lecithin. Phosphatidylcholine helps repair the liver cell membrane directly, improving how well cellular is absorbed into the body. Taking cellular alone is far less effective than this combination. Talk to your physician before starting any supplement, but this combination has solid peer-reviewed evidence behind it. Your liver is regenerating right now. Unlike most organs, the liver has a remarkable ability to heal itself, but only if you give it the chance. The 5 signs I described today are not a death sentence. They are an early warning system. Your body is talking to you. The question is, are you listening? Do not wait for a diagnosis to start taking care of your liver. The damage happens silently. The recovery can too, if you act now. Your health is your greatest wealth. Protect it like it.